for joining us on this beautiful Friday morning. Hope everyone gets a chance to get outside and enjoy some beautiful sunshine wherever you are. We're excited to have a few guest speakers with us again today to talk about what's going on. It's been quite the week here in North Carolina and all over the world, as you all know, and there's been a lot of actions that have been happening as well. I'll say, first of all, thanks to all of you all who signed on to the advocacy letter that was sent into the General Assembly this week. We had over 75 organizations and have been getting a lot of positive responses from state legislators and others. And I'm sure we'll be talking some more about that. So just looking through the agenda here today, first we're going to have our update from Matt Gross with DHHS, who's joining us to talk. Hopefully we're working through some technical difficulties there. Next, we're going to get a legislative overview, once again, from Ashley Perkinson, the NC Child lobbyist. She's going to talk about some things that are on the horizon and have been going on legislatively. And then after that, we're going to be hearing from Alexandra Sirota, who is the director of the North Carolina Budget and Tax Center at the North Carolina Justice Center, who is going to be talking about the now more crucial than ever conversation around unemployment insurance in North Carolina. And then lastly, we'll do a round robin and take your questions and get any other updates that you all may want to let us know about. Remind you to please use the chat box throughout the presentations if you have any questions, and Fawn Pattison on our staff will try to kind of collate those and ask those questions back out to our presenters or at times that are appropriate.
Adam, I have an update from Matt. Sorry to interrupt you, but we don't have Matt Gross on the call today due to security issues with Zoom. DHHS folks are not allowed to participate right now with us in Zoom meetings. So what we're going to ask is if folks have questions that you want us to pass along to Matt, please go ahead and enter those in the chat box, and we'll be following up with him after this call wraps. So I'll keep an eye on the chat box. If there's questions we can answer right now, we'll try to do that. But for the most part, we expect we'll just pass those along to Matt and then get those back to you as quickly as we can.
Okay, thank you, Fawn. And I know this is a growing concern among different organizations and state government agencies around Zoom security with some things that have been going on, sign of the times, but we will certainly get that figured out for next week. And like Fawn said, I'm sure Matt will do his best to try to answer any questions that come in here in the meantime. Well, without Matt on the call, I think that we should just go on now to our next presenter, Ashley Perkinson, who can share with us a legislative overview. So, Ashley, are you with us?
I am here. Can you hear me, Adam?
I can. Hello, good morning.
Terrific. And can give me a thumbs up if you can also see me. Okay, there I am. Hello. Well, good morning, everyone. And I hate to hear that Matt is not on the call this morning, but I will just give a plug to the incredible resources that are found on the DHHS COVID-19 website. They have a long list of resources for health providers, for consumers, and have been doing an incredible job keeping everyone up to date with webinars. So do check out his or the DHHS website. And my video has, can you hear me? Just give me one more thumbs up. Okay, great. All right, so now on to the legislative update. The General Assembly has had a busy week. Now, as we mentioned on our call last week, the interim committees, those oversight committees that typically meet during this time before short session, those have been postponed or canceled. So those have not been meeting. However, the House Select Committee on COVID-19, those 4 working groups, Each of the 4 working groups have met this week, and so they've all met since our call on Friday, and just would like to give a run through of what happened during each of those working groups in their meetings this week. And again, these working groups are bipartisan working groups. They have chairs from both parties, and those kind of technology hiccups that I mentioned last week, those were pretty much smoothed out this week. So the video conference meeting with the legislators and presenters ran pretty smoothly. So I think we'll continue to see those meetings take place in the coming weeks. So again, the 4 working groups, you've got the health working group, the education working group, the continuity of state operations working group, and the economic support working group. I'll begin with the continuity of state operations. So that working group met this week and heard presentations from the Department of Public Safety and also from the League of Municipalities and the County Commissioners Association. And something to point out there, as we mentioned on the call last week, the concern with revenue coming into the state, obviously with the economy slowdown, and then also with the tax revenue coming in at a later date being pushed back, concerns with the state revenue, but the representatives from the League of Municipalities and County Commissioners Association also talked about the concerns with that local revenue coming in, both from sales tax, from occupancy tax, all those local taxes that we think about are also coming in at a slower pace, obviously, with the economic downturn. So that was a big theme of their presentations. During the presentation of the working group for economic support, they heard from the governor's liaison, Lee Lilly, also from Thomas Stith. He's the director of the North Carolina Division of the Small Business Administration. And for those of you who are interested in learning more about those Small Business Administration loans, he did a terrific overview of the process and the loans available both for for-profit businesses and for nonprofits. That presentation is available on the General Assembly website. If you just go to the COVID-19, the House Select Committee on COVID-19, that resource page and committee page, all the presentations that I've mentioned, they're all available. And this has some really great resources contained in that presentation as well. The Golden Leaf Foundation also presented along with industry reps from the restaurant industry and also travel and tourism, and talked about the huge hit that have hit both of those industries. Now with the health working group, and I know that's important to all of us on this call, the presentations that were provided at that working group committee, it started with Deborah Landry. So I mentioned last week that they didn't get to Deborah's presentation and discussion on her summary of federal legislation and its impact on health and human services in North Carolina. So she was first up this week. Her presentation was to go over that chart that I mentioned, and it is also available. It does a terrific job of breaking down the pieces of federal legislation that have passed and impact on North Carolina. Secretary Cohen also presented and really highlighted the need for the General Assembly to fund their important initiatives from the infrastructure of our healthcare system to crisis services, mental health services, also underscoring the need for the personal protective equipment and ventilators, and those serious concerns, obviously, in response to COVID-19. We also heard compelling updates from the directors of the health directors from both Mecklenburg and Johnston County and the impact of COVID-19 on their areas. And with the education working group this week, as I mentioned last week, they focused on K-12 updates. This week they focused on higher education and heard from the UNC system, from the independent and private colleges and universities system as well. And want to also mention, as Adam stated at the beginning of the call, just a strong shout out to the 75 plus organizations that signed on to the NC Child letter that lists the NC Child's recommendations to the legislature. That was an incredible showing, and NC Child submitted the letter to the General Assembly, and we are in the process. We've got a number of legislative meetings set up for next week, where we'll be meeting with legislators through video conference, although maybe not through Zoom. I don't know. We might have to revisit that. But we'll be meeting with them through video conference next week to go over those recommendations. And for those of you on the call who signed the letter, and for those of you who maybe didn't but still support the recommendations in the letter, please feel free also to reach out to your legislators to underscore the importance of those recommendations, because it's great for legislators to hear from multiple sources. So with that, oh, and I will mention before I turn it back over, the public comments. I mentioned that the General Assembly has the website where anyone can provide the public comments to each of those working groups, so you can designate which of those working groups you want the comments to go to. The full compilation of all of those public comments are also available on that General Assembly website, so you can see what people from across the state have submitted to the General Assembly. So with that, I'll turn it back over to Adam.
Thanks so much, Ashley, and we truly appreciate you also helping connect all the organizations, really, in a way, on this call to the legislature, you know, through your updates as well as through making contacts to have conversations with them. And I think that some of those are going to be really productive. I mean, everybody right now, I think in earnest, is trying to figure out good solutions for North Carolina. And it's unprecedented in a lot of ways. So I urge everyone, in the meantime, as Ashley said, you know, please reach out to your local legislators, you know, give them words of encouragement, let them know some of the things that you're supportive of and hoping will happen. All of that will hopefully go a long way this month as we get prepared to come into the short session. One question I have, Ashley, just, you know, before we move on, we got a few extra minutes since Matt, you know, wasn't able to join us. Thanks for mentioning those small business loans, because we've been hearing from a lot of folks who obviously, you know, their business is hurting from this. They're in a pinch. And it's my understanding that some of those loans are going to be made available very soon, but that they're also going to be figuring on a very high demand. Did they talk any about that?
Yes, they did, and you know, and the concern obviously with the systems being hit with the number of applicants, but hopefully with the amount of federal support and the money's coming in, that they'll be able to roll those loans out somewhat expeditiously. And again, that the presentation that Thomas Stith put together, it outlined the full process of what the contact numbers and information that businesses and nonprofits can go through. So it's still too early, I think, to tell how expeditiously they'll be able to roll out those loans. And for some of the loans will turn into grants if are able to keep their employees on board. But time will tell, I think, whether people will be able to get those loans in time before a real crisis for those individual businesses.
Right. Yes, certainly. And then I know you mentioned that those resources are available through the General Assembly's website. Is that correct, for all of these various presentations to the committees?
That's right. And so so a couple of different things there. Even though the legislators, when they have the working group meetings, they're able to see each other through the video conference platform. During the working groups, you can tune in to the audio portion of those presentations and hear the full discussion. The PowerPoint presentations from all the presenters, and I think pretty much all of the presenters have had substantive PowerPoints, and they've pretty much gone by point on the PowerPoints. The PowerPoints and the letters, some of the organizations, like the Nurses Association, for example, presented during this, and they submitted a letter in addition to their PowerPoint. So those documents are available on the ncleg.gov website, so that you can see the thing that you miss if you pull up the documents. The main thing that you miss is the Q&A, the back and forth between legislators and presenters. That's not available on that website, just the documents. But the documents, I think, are really helpful in themselves.
Okay, thank you. And just to reiterate, like Ashley said as well, we're going to be having conversations, members of NC Child staff, with some of the legislators in the coming week and coming weeks. And we will basically be talking about the issues that we highlighted in that letter. And it's funding what's going on with food assistance or foster care and supporting foster families and biological families, all the way to health coverage and Medicaid, et cetera. I'm wondering, Ashley, if you're just getting any sense of what are some of the priorities that seem to be coming forward so far.
Wow, and that's a great question, and I was actually just thinking about that question this morning, and just the significant number of asks. I mean, every presentation that you listen to has a significant dollar amount request attached to it. So just listening yesterday to the education working group, the higher education system. I mean, each of the different presenters, the community colleges, the private colleges and universities, and the UNC system, they all had funding requests, and that's along the same tone that we've heard in all of the other presentations that were made. So I think with this being such a health crisis, of course, I think the health funding requests will rise to the top, and Secretary Cohen outlined a number of those requests. But I think it was really smart of the House to put together an economic support working group as well, because so many people across the state and industries across the board are suffering. So I think there will be a flood of requests, healthcare, and of course the education concerns, the food insecurity issue, the issue with children being out of school for so many weeks, and funding needs there. So it will be a pretty overwhelming, I think, request to legislators, but all of these are really important issues.
Yeah. And we are, in addition to encouraging people to contact their own legislators, it's just for everyone's FYI on the phone, we are also encouraging people to contact Speaker Moore and Senate Pro Tem Berger's offices, just because they are leaders in the North Carolina General Assembly. We also encourage people to contact the governor's office, because we are fortunately seeing some good cooperation on some various things so far. And we want to just make sure that we're emphasizing to not only every General Assembly member, but also the state leaders of what some of these priorities are moving forward. I know, and then the other thing I'll say too is administratively, we will continue to advocate. And there's really, to be honest, the list of administrative things that we're asking to happen or want to see happen probably are 10 times longer than the legislative list, just because there is quite a bit of flexibility with what state agencies can do in order to help people in this time of crisis. And we want to make sure that we're being supportive in every way we can. And so we encourage people also, if you've got ideas around that, the administrative asks, we're putting an administrative letter together that we should be releasing, I'm thinking early next week, that will have a laundry list of things that are mainly going to DHHS, but also covering juvenile justice, as well as some other areas of concern that we have. And I know that Secretary Cohen has talked quite a bit about Medicaid flexibility and how they're filing waivers at the federal level and trying to get those approved so that they can handle things a little differently at the state level. I wonder, have you gotten a sense of how that administrative and legislative work is starting to come together?
That's a great question as well. And with the 1135 waiver being approved from DHHS and the other waivers that they are seeking, I think what we're seeing is good collaboration, because with those waivers, that's going hand in hand also with the impact of the federal legislations that has passed. And so the legislators are really trying to figure out how to get the most bang for the buck with the federal dollars that will be coming down, and also trying to keep track of those administrative changes from CMS, and the flexibility that it's providing healthcare providers across the state. So those different tracks are moving in parallel.
Yeah. Thanks so much, Ashley. I know I'm peppering you with questions this morning. The last thing I'll say too, before we kick it over to Alexandra, unless you have anything else, is just that we'll also be keeping our eye on the federal level. I mean, obviously the last stimulus was mind-bogglingly huge. I mean, $2 trillion, going to a lot of different things. We hear that there's another package certainly that's in the works. I know there's a lot of discussion about doing infrastructure and infrastructure spending, and also having Medicaid and other health asks at the federal level. So I just want to remind people, let's not forget about our congressional delegation as well as we move forward with this, and we'll be keeping everybody updated on that front too. All right. So thank you so much, Ashley. You're a wealth of knowledge. We appreciate your insight, and we look forward to chatting with you next time.
Thank you, Adam. Thanks, everybody.
Yes. So next on our agenda is Alexandra, who is the Alexandra Sirota, who I'm sure most of you on this call know. She's the executive director with the North Carolina Budget and Tax Center. And Alexandra, I know, has been working around the clock this week and prior to this week, with this crisis setting in here in North Carolina. And we just so much appreciate the work of the Budget and Tax Center and the valuable resources and ideas that you all have and share with everyone. And Alexandra is going to talk to us today specifically mainly about unemployment insurance in North Carolina and what's going on with that system, seeing that it's being greatly impacted. The numbers, again, are kind of historic numbers of people filing for unemployment. So Alexandra, good morning. Welcome. You're on mute. There you go.
I'm still learning the Zoom. Thank you for having me. I didn't know if I should share slides or if I should just talk for 5 minutes. I'm happy to share a few slides if that would be helpful. Is that preferred?
Yeah, if you have a few, and Fawn, I don't know if you can, either whoever wants to drive that, either person, but
I can do it from mine if it's okay to share my screen.
That's great, Alexandra. Yeah. And I can also help advance your slides from here. So, but if you want to go ahead and share your slides, that's great. Thank you.
Okay. So I just wanted to make one comment off the topic of unemployment insurance about the historic package that Adam mentioned was passed, the CARES Act. And I think part of the reason for the discussions already beginning on a fourth package is because there were real limits in that CARES package despite its size. And you'll see some of that in these numbers I'll share with you. The scope of the economic harm from this public health crisis is really a struggle for economists across the country to get their hands around. Never have we seen really so quick a change in our economic position and in such a widespread and damaging way. So most of the estimates that are coming out on the economic harm and the job losses are every time new data comes out, we're finding there are millions of people off in terms of the scope of the damage. So not to be too down about what we're dealing with, but I think it's helpful to be realistic about the fact that the unemployment insurance system is a really critical tool, and what happened with the CARES Act was a critical stopgap for that system to really serve its purpose in the state. But we definitely are going to need a wraparound set of supports for the economy to recover and for people to get back to work. So part of containing the spread of COVID-10, of course, is not just, sorry, that should say COVID-19, is recognizing that people, in order to social distance, have to stop work. Businesses are closing. We know that there are certain occupations and industries that are more vulnerable to job loss in these times, and that many of the workers in these industries, such as hospitality, food service, are frankly often paid lower wages. And so the existing vulnerabilities in our economy are being really laid bare by this issue of social distancing and the job impacts. So many of you likely saw yesterday, the country saw a historic increase in the number of unemployment insurance claims each week. 6.6 million people across the country claimed unemployment insurance. That's a 3,000% increase over 3 weeks. In North Carolina, more than 170,000 claims were filed in the last week of data. So to put that number in perspective, the average weekly claims last March, in March 2019, was about 2,800. So the system of unemployment insurance is really one of the frontline tools we have, and it's clearly under strain as the economic harms of the public health crisis play out. I want to talk a little bit about how unemployment insurance works, but just to show what the policy choices have been to date, I think is important. So many of you likely know that Governor Cooper, when he closed or when he ordered, started to close down certain businesses, he also pursued flexible interpretation and waiver of certain North Carolina unemployment insurance requirements. The two major ones that he pursued was the removal of a waiting week. So what happens, this is a holdover from before we had technology. When someone files for unemployment insurance claim, they need their employer to verify that the job loss was through no fault of their own, and they wait a week for that process to go through so that they lower their error rates. Waiting weeks have largely been abolished across the country because of technology. We can do that verification much more quickly. But North Carolina put waiting weeks back in place. The governor waived it under the executive order, and he also waived the requirement to be able and available to work to apply for unemployment insurance, since obviously people are not able and available to get to a job right now for the most part, and unless they're in the essential worker category. And then he also waived the work search requirement. So that means that people will no longer have to prove that each week they're searching for 5 jobs. They've applied for 5 jobs. The claims are also not charged to employers. So this is important on the employer side because employers pay their unemployment insurance taxes based on the number of people they lay off in the history of their time in business. And by making these claims non-chargeable, it basically means that their unemployment insurance tax rates won't change as a result of their employees applying for unemployment insurance. All of this executive order allowed the state to draw down administrative support and funding through the family's first coronavirus. So this is the second package. And we know that that administrative funding is coming at a critical time as these historic claims run through. I will just note, and many of you have likely heard, that there are the time it takes to get through to someone and to actually file a claim is quite long right now. We have heard that they are adding call centers, they're working on their online systems and upgrades, but clearly these dollars need to be deployed into the infrastructure to be able to handle the volume that exists. So I think the major reason that I was asked to talk now on this topic was because of the CARES Act, which provides a significant expansion of unemployment insurance benefits. And these are 100% federally paid. So this is not drawing down the state's unemployment insurance trust fund. It is not affecting the existing underlying state program. And I won't get into it here for sake of simplicity, but I do want to emphasize the fact that without the CARES Act, North Carolina's unemployment insurance system would have been wholly inadequate to support workers in this time. Our unemployment insurance system is among the worst in the nation. At the state level, we provide too few workers with too little in wage replacement for too short of a time. Our current duration is just 12 weeks. So what this federal bill does is really make sure that people who are out of work during this time are supported with wage replacement and don't get pushed further into poverty and hardship. Importantly, the act increases eligibility or expands eligibility to more kinds of workers. So typically independent contractors or those who are self-employed are not eligible for unemployment insurance. These program changes at the federal level will make sure that those workers can access unemployment insurance benefits through the end of the year. There is also, on top of the state benefit, a federal supplement of $600 a week through the end of July. And this number sounds like a lot, but for North Carolina, this would basically result in almost 100% wage replacement at the average weekly wage. And the reason that that's critical at this time is that without wage replacement, so many workers are going to face the challenge of meeting bills, meeting needs in community, and for their families without that. Our unemployment insurance benefits without the $600 supplement a week would be just $270. And so that is not sufficient for a family to make ends meet in normal times, let alone in times when we can expect that there would be different cost structures to a household budget. The program also adds on weeks to the state duration. So with eligibility, once someone exhausts their regular unemployment insurance weeks, they are eligible for an additional 39 weeks. So this is a critical policy change. Just to put in perspective, that $600 amount, again, North Carolina's wages relative to our neighbors are relatively high, and that $600 a week is going to be a critical support to families who are trying to stabilize their household budgets. Before I close, I will and talk about some resources that I think would be helpful as you're hearing from folks in your communities about these issues. I think we know that the job losses are staggering in this moment, and I kind of alluded to that with the unemployment insurance claims. But one thing I think we need to be really thoughtful about is there is a near-term impact here and there is a long-term impact here. And we need to begin making sure that we're having a conversation about that long-term. Projections that were released on April 1st suggested that job losses by the summer of 2020 would total more than 20,600,000 in North Carolina alone. By this April 2nd, with the release of the UI claim data, these estimates are now considered too low. So we're dealing with a situation in which the economic projections are rapidly changing, and they're becoming more and more challenging for systems to keep up with. And the unemployment insurance system, again, is one of those critical tools to provide stabilization to workers during an economic downturn, both the immediate effects and, again, the long-term effects. I want to make sure to just send a message about resources. I have some links to fact sheets and eligibility materials. The big message I hope that you'll take is that if you hear from someone, if you know from someone who isn't sure if they're eligible, is confused at all by any of this, they should apply. At this moment, anyone who thinks they could possibly, even if they think they couldn't be eligible, everyone should be applying for unemployment insurance who has lost work or lost wages, because it's really critical that we're reaching the most number of people. Again, unemployment insurance is not just about stabilizing the household, it's about stabilizing the broader economy. And if people aren't getting funds into their household, that puts that stabilizing effect at a lesser impact. So I'll stop there and take any questions. Hopefully that was enough.
Thanks, Alexandra. That was great. We do have lots of questions coming in for you in the chat box. First question I see is from Vicki Lewis, and she's asking about employees who are at higher risk. For example, if an employee has a condition such as COPD and they work in a hospital setting, putting them at risk, how should they handle this with their employer?
That's a good question. So I will just say that I'm not a lawyer. But I think what we know is that people who leave work for health reasons and who can verify the health reason, that they can apply for unemployment insurance. One resource for any advice in these moments is obviously the Legal Aid of North Carolina is a great resource with lawyers, and I'm happy to also share information with my colleague Bill, who couldn't be on the call. Mm-hmm. But someone who is in that situation is right now eligible for unemployment insurance. They could leave their job and receive unemployment insurance.
That's great. We have another question we have one from Natasha Adwaters. Could you explain the difference between furlough and layoff in terms of access to unemployment insurance right now?
Yeah, so this is a complicated situation in that, again, for most folks, they're actually furloughed, they're not unemployed. It's a reason why the labor market data isn't going to necessarily capture all of the unemployment in our economy right now. So for the purpose of the federal program, if they have been furloughed, let go of their job, but expect to be called back, they can apply for unemployment insurance during the time that they are furloughed, if that makes sense. So this is an issue that is addressed in part by the governor's executive order on waiving the requirement that people are able and willing to work. A furloughed worker is obviously just waiting to be recalled back to work. What won't be possible is for someone to be on payroll and receive unemployment insurance, if that makes sense.
So there's a follow-up question here, and it's actually from Greg Borum, clarifying, even an hourly worker that has lost hours but not lost their job, should they employ for unemployment insurance?
I need to get back on that, but yes, I think the understanding is lost hours are part of the calculation. What we don't have is partial wage, so we don't have a short time compensation program in North Carolina. That's one of the recommendations we have for the General Assembly. which it would more clearly make unemployment insurance payments available to those who lose hours.
Great. And Kelsey Kemp is asking about getting a link to resources for employees who are getting hours temporarily reduced and whether they'll be able to apply for unemployment insurance. Alexandra, I know you have quite a few links and fact sheets and some helpful information. And if you can share those with us, we'll make sure that everybody who is on the call gets access to those resources.
Yes, I will do that. Absolutely.
Great. I do not see additional questions coming in on the chat, but folks, if you have questions for Alexandra or questions for Ashley Perkinson, who presented earlier, or anyone else on the team here, please go ahead and enter your questions into the chat box.
There's another question here, Fawn, if you just noticed.
Yes, I see one popping in from Teresa. If you have an employee who is not compromised in health and their family's not at elevated risk, but they really are just not comfortable continuing to work, if they are considered an essential place of work, could they choose to quit and still qualify for unemployment? And this is actually, I don't know whether this is what Teresa is referring to specifically, but I will say that we're hearing from a lot of childcare providers right now about working in unsafe conditions, and who have children at home, people who may not have health coverage and are terrified about what would happen if they got sick. So, and that's considered an essential service. So would they be able to qualify for unemployment if they were to leave their position right now?
So I think that the general thinking right now, and folks on the phone from NC Child can correct me, but I think the general thinking is that yes, they could, but I would want to verify that with Bill and get back to you with a resource to cite, because I think there is a lot of confusion still in the near term, particularly for essential workers. And that definition is quite broad at this moment. So, yeah.
Thanks. And we have a question about gig work or side work, which is a big part of our economy these days. Linda Block is asking, if someone did side work or gig work but didn't claim this on their taxes, can they apply for unemployment?
Yeah, so the point of this new expansion of eligibility for the federal is that those folks who are independent contractors or some kind of gig worker will be able to apply for unemployment insurance. They will have to present, so in order to calculate the state level benefit, they will have to present some evidence of income level, because that's how they calculate the average weekly wage.
Thanks. And we have another question. This is from Sue Sproat, and this is an important question that I think a lot of nonprofits are wondering about. It may be a question for an attorney, but we cut the number of hours for current employees. Under the payroll protection bill, and with the increase of $600 to federal unemployment, should we go back to pay our employees their full-time schedules?
Yeah, so I would not feel comfortable giving advice in that situation. I think so one group that I know is providing significant advice to employers and nonprofits is the Charlotte Legal Advocacy Center. They've set up a special set of a special legal team to provide input and advice. And so I would direct folks to ask those lawyers for information about how best to make decisions across the various programs.
That's great. And we'll share a link to the Charlotte Legal Advocacy Center with folks after this call. I don't see more questions coming in right now. But if we get more, we can certainly relay those. Alexandra, thank you. I'm going to pop back up the slide just with the general link to NC Child's resource page, so folks have that link in front of them. So I'm going to share my screen, but please, y'all continue the conversation and continue the questions.
Great.
Yeah.
Thank you.
Oh, I have one question, Alexandra, and I don't know if you've got any insight in this, but it's my understanding is that when people file for unemployment in North Carolina, the vast majority of people are actually rejected for receiving benefits. And do you know how that might change given our current circumstances?
Yeah, so we have a very narrow set of eligibility, which is why most people are rejected. We also have, because of the limits on time and type of employment on the state law, that has created limits on eligibility and receipt. So we do have the lowest level of receipt in the country for state unemployment insurance benefits. I think that's going to change dramatically under this CARES Act because it both changes who's eligible and changes the funding source for the program. So I think we will expect to see more. I also think we're in an incredibly challenging time for the Division of Employment Security. The kind of volume that they're seeing, you know, we heard a report yesterday that they were getting 20,000 calls an hour.
Ooh.
So they just do not have the capacity to move things through the process and frankly bring administrative hearings forward. Looking for ways to streamline verification with employers. What can they do online to get verification of income online? You know, everything they can automate, they're trying to do. So I expect that, and I would hope, again, because it's critical not just for families, but for the economy, that we're able to make sure that everyone who needs this wage replacement is accessing it. And again, I think we also have to be attentive to the fact that this $600 a week is only now through July. And so making sure that we're continuing to monitor whether we need an extension on that or whether we need fixes to the state system to fill in when that goes away is going to be critical.
Yeah.
Alexandra, we have a follow-up question back to the question about gig work. This is from Linda Block. Could someone who does gig work but didn't report that as income for tax purposes get penalized if they now were to apply for unemployment, like they get found out?
I don't know. Yes, that's a possibility. It's also true that you have to pay taxes on unemployment insurance payments. So that's a little known fact, but it is the case, and that isn't changed under this rule.
And I think that, I mean, as Alexandra said, and we've all, I mean, seeking out resources as much as possible is going to be key now. And it's tough because, like you said, D is completely inundated. Our good friend lawyers are going to be completely inundated. But we've got to, you know, now is the time to be very dogged about it, I think, as advocates, if we've got questions around this. And there's all of these nuances within this, right? I mean, we're really in unprecedented times now, too. And that's where it's going to take some of that digging in and certainly sharing these resources as we're going to do. And the more we all find out, of course, we will try to share out with everyone. But even at NC Child, you know, we have, I'd say more than anything, we've been getting hit with these unemployment related questions. And what do we do in this situation? What do we do in that situation? We can't get through to DES to talk to them, et cetera. And unfortunately, I think that is just going to continue for the next couple months or so. And so we'll do whatever we can to be a resource for folks and share information. The other thing about North Carolina, as we move forward and advocate, and I do think that across the state, we have an opportunity to really push on the unemployment insurance front, and we should. We've got $4 billion in the unemployment coffers at this point in time in North Carolina, and so we've got some money to rely on there, but this should be priority 1A, I feel like, as the General Assembly gets back to work.
We agree. It's a big one. Thank you.
Yeah, thank you, Alexandra. Okay, so great presentation and information. Thanks so much, Alexandra. You all, if you're not also subscribed to the Budget and Tax Center's list, I encourage you to do so. They kick out lots of great information on various topics. We're running up against our time here. We've got about, it's 11:50, but I do want to provide opportunities to answer any other questions that folks might have if you want to enter those in the chat box, or either Fawn or Michelle, if there's anything else you'd like to chime in on before we wrap up the call.
This is Fawn. I do want to invite folks to share some of the challenges that you're facing, the needs that you're seeing, the questions that you have for the larger community. I hope that you all are hearing from your funders about what you need. We are certainly getting those questions, and we really want to lift up to them what is impacting you all in your work, in your day-to-day, and share those needs. And we want to know how we can help you best. So please, if you don't want to share in a Zoom chat, email us, keep us informed about the needs and the challenges that you're facing. And then I also want to remind people that we are recording this webinar. We will record a Spanish language version as well, and we'll be sending both of those out to you later today by email and posting them on our website at the link that you see up on your screen right now. And we're getting a couple more questions in the chat box, so I want to share those. These may be questions for Alexandra as well, and for Adam. So this one I think is for Alexandra from Lisa Nesbitt. Is there any ability for those who were looking for work before this hit to collect unemployment? So if you were already unemployed, can you now get those benefits?
Yes, they should apply, I think is the message, because COVID-19 has disrupted the labor market so much that it's impossible to be looking for work right now.
It sounds like that's your bottom line message today, Alexandra. If there's any doubt in your mind, apply, apply, apply. Go get those benefits if you possibly can.
Yes.
And then from Greg Borum, would like to be in on conversations regarding the administrative ask that we're putting together if possible. Adam, do you want to share a little more information with folks about how they can get involved in that?
Yeah, I mean, I would say first and foremost, just to keep it simple, Greg, I'll follow up with you, and everybody just email me or call me, adam@ncchild.org. Sierra Zachary on our staff has been pulling together, kind of leading the charge on pulling together these administrative asks, and we're all trying to fine tune those and have been taking into account various organizations' feedback and seeking that out. However, the more the merrier, and we certainly want to be inclusive, because the other thing is we need to be working together on these administrative asks when we go forward, with things that we feel like really we want to see happen, and figuring out the best way that we can press forward and put pressure where we need to actually get it done. I mean, this is, in the midst of all of this craziness, the time for advocacy and for us working together, because what's going to happen over the next 3 to 6 months, and what's already happened policy-wise in the last month, is just, quite frankly, going to shape what's going to happen for years, if not decades ahead in some ways. And so, we can't press upon people enough the urgency around this and the need for us to involve more and more people. Now is the time where all of us need to be reaching out and getting our friends and neighbors, those who normally say, oh, well, you know, I don't know about all that political stuff. You know, now's the time where if we can go to them with some simple, concise actions that can make a difference. We are seeing that there's more desire to do that. I mean, we posted something on social media about childcare providers and what's going on in childcare centers, and it's just taken off like wildfire with, you know, 400 or 500 shares because everyone's concerned about what's going on there for now. So that was long-winded, but and I see we have another question.
Yeah, just a follow-up question from Greg. And I don't know if Vicki is on the call. I can see if I can promote her to help answer this, but I think this is a question from Alexandra. What benefits will workers without citizenship documentation or residency documentation be eligible to receive? So even if their children have citizenship status.
This is Alexandra. So I do have a fact sheet that I'll share in the resources on immigrants and unemployment insurance. One of the other aspects of the CARES Act that I'll just lift up that many folks are concerned about is that the cash aid payments, the $1,200 that have been discussed and that are part of the CARES Act, those eligible to receive them must have Social Security numbers. And so ITIN filers will not have access to that cash. And of course, that's a huge problem if we're not providing income into all households at this time. In our estimation, it is approximately 300,000 adults and children who would be impacted by that exclusion that exists in federal law right now. But I'm happy to share the unemployment insurance fact sheet with folks.
Alexandra, were you saying that's 300,000 parents with children in North Carolina who would be excluded?
Parents and children.
Got it.
So the way it's worded, and there is still clarifying language coming out. Obviously, this is all moving very quickly, but if anyone in the family doesn't have a Social Security, no one in the family can receive the benefit.
Mm.
And I think we're seeing a clarification that there is an exception there for military families.
Okay, well,
thank you.
Yeah, thanks everyone for being with us today as part of this weekly update. Please share information about these updates with others, encourage others to join us as well. And if there are any other questions or things that arise, always feel free to reach out to me as well. I know Fawn shared the email there. Fawn, do you have anything else to add before we wrap up?
I don't think so. Just a huge thank you for Alexandra, to Ashley for sharing your time and your expertise. And if folks did have questions for NCDHHS that you weren't able to ask Matt today on the call, please feel free to email those to us, to Adam or to Eva, whose email address is up on the screen right now. And we will be getting that follow-up information from DHHS to share with all of you.
Yes. Okay. Thanks, everyone. Have a wonderful day. Stay well.